First off, happy St. Patrick's Day to all of you. For a little humor, I just got off the phone with one of my colleagues who is Irish and a New England Patriots fan, and they just got their first 2 cases of COVID-19 in their county, so he's having a great day. Wanted to certainly reiterate a couple things. Every step we've taken along this has been about flattening 2 curves. Flattening the curve to maintain our medical infrastructure, and that has been driving all of our decision making along this, knowing that this day would happen and we would need our hospitals and emergency management professionals able to perform their jobs and perform them well. Secondly, taking policies that would flatten the curve in regards to the infections. And right now we are in full mitigation mode in the county. We are trying to starve the virus by limiting contact amongst human beings. And so we will continue to come out with social distancing policies that we believe will have an impact in flattening the curve. We may be out with new policies later today. But certainly 2 of the major challenges that we have as a county government, we have always had to take care of our communities vulnerable. Our children, our poor, our elderly. This challenge is creating new pockets of vulnerable in our community, specifically our independent seniors who for their whole lives they've been independent of this types of needs and services. They've been able to get out in the community and live life. Right now we are encouraging our seniors to please stay home. Please manage who you have communication with. Not face-to-face communication. Obviously, please stay in touch with all your loved ones. And also, if you need help, we have created a separate phone line for you, which is over there, 315-218-1987. We've had that line open for less than 24 hours. We've already received 130 calls. So as we continue to get feedback from our seniors who need help, we will continue to build up the infrastructure necessary to help you get your questions answered and help you get the services that you need. So please call that line and continue to use us as a resource. We're here to help you. In addition to that, we've talked a lot about daycare over the last really week or so. Daycare is critical. I want to first thank everybody in the daycare industry. You are our community's heroes on the front line today. You are underpaid and you are no longer undervalued. So I want to thank you first and foremost for that. Without you, the people in charge of responding to this challenge in front of us, this is a pandemic, would not be able to do their jobs. And that's what this has all been about. So I want to thank everybody. Saying that, we've been working on strategies, our teams, with all of our daycare partners. I want to obviously thank all of our team in county government, in all of our departments who are working 24/7 right now to respond to these evolving challenges. And we're happy to report that our partner, through our partner Childcare Solutions, we have prioritized over 250 slots for hospital workers, nursing home staff, and first responders. So your children are now at home. If you have daycare shortages, we now have slots available for you. I want to give you this phone number to please contact to exercise your ability to get one of these slots, 315-446-1220. It's critical that we get our healthcare providers, nursing home workers, and everybody at work. We really need you to come to work. We have slots here. We're also looking in the event of any shortages in daycare slots about potential surge sites where we will open them up once we know if there is a shortage there for childcare slots for an emergency basis. If the person who is watching your children can no longer watch your children, we're looking at surge sites. In addition to that, I've gotten a lot of great feedback from the community at large. There are a lot of seniors and juniors in high school who are now home, who feel good, they feel healthy. They're now going to be bored because they're not going to be playing with their friends. Certainly, we will ask all high schools to consider using service hours if these individuals help out with child care throughout the weeks within their own respective communities. This wasn't my idea. This came from many of you who've been emailing me very much. We are here today in our Emergency Operations Center. This is a facility and a venue, and I know you'll all be able to get a quick tour after, where our emergency management teams can get together and really act live to the needs in the community with live real-time data and having everybody in one floor, in one building. This is critical as we get various pieces of information from the community where there's shortages, where there's not shortages, so we can help complement and implement strategies to make that happen. A couple other things. I want to specifically thank the Budman Company from Liverpool. This is what we're talking about when coming together as a community. The Budman Company got in touch with us and has donated 50 face guards, and they're going to be making an additional 300 of them for us tonight. Obviously, we will pay them, but this is what we're talking about with companies that can have the ability to do things, stepping up, reaching out to us with your innovative ideas on how we can face this challenge together. And certainly we have our triage site that was opened up yesterday has been busy. We have had 441 referrals to the Syracuse Community Health Center triage site. That does not mean we've had 441 tests. They've been referred there, and certainly many of those people did get tests, but many of them were not symptomatic and did not. So saying that, I'll have Dr. Gupta come up. Yep, social distancing, Dr. Gupta, we're there. And Dr. Gupta will give you a briefing on some of the medical facts at this time. Doctor?
Thank you. So at this point, as you all know, we have 2 cases in our community of COVID-19, a elderly couple. That has not changed. We have continued to do our contact investigation, and we have not seen any alarming trends there. That's something I would like to reassure those who we think should be contacted based on the interview with the both patients. We are have reached out or in the process of reaching out. So we just want to reassure everyone that if you have not been reached out, it means you are not in the territory of the quarantine. However, I would like to remind all of you, this is considered a community transmission. That means it was not travel related. So we are going to be very extra careful. We are going to continue to think about social distancing, washing our hands, staying home if we are sick, calling the doctor. All these things really make an impact because it is changing our lives, but yes, that's for a short term. So having a little difficulty in the short term will have a long-term health gains. That's what we are looking for. Life will be changed for next several weeks. We don't know how long, but we all need to accept and support each other. So I'm asking all of your support to work with us and do whatever you can do to protect not only yourself, your family, your neighbors. Check on each other, be there for each other. So thank you.
Thank you. And our 2 positive cases are health-wise doing well?
Yes.
Yeah, they are doing well. Remember, these are our neighbors. These are not people. These are our neighbors and our loved ones. So, saying that, questions?
The status of the 2 people. One, the male is still isolated in his home, quarantined, I should say.
Yes.
And the woman, the first case, is in the isolated room at the hospital.
Yes.
Okay. And do we know a condition on her?
So she's doing good. She is stable, but not ready to be discharged home at this point.
And could she be discharged if she improves in terms of needing to be in a hospital and continue the isolation, the
Yes.
quarantine at home before that negative test?
Right.
comes?
So it will be like in any other scenario, right? If somebody is admitted with a pneumonia and then you need hospitalization for so many days, if they require oxygen, if they are not able to walk good, some of those things are very important because these people are independently living in their own home. So before they can get home, you really need to make sure that that person can be self-sufficient in taking care of your daily activities. And if there's no fever, there is continue improvement in the clinical signs. There are certain criteria doctors use for the discharge. That's where we come into the picture, and then we will make sure to have that isolation at home or mandatory quarantine. That's kind of, we use equal that word. And we will make the connection and provide all the support she needs.
Would you reiterate and expand on what you said earlier, that you're seeing no alarming trends in connection to those 2 cases?
So at this point, what I meant to say that we have, this is there's no travel related to these two individuals. And when we do investigate, we try to find all those individuals who might have been contacted, depending on how much people were out and about when they were during the time of exposure. When they were having a lot of symptoms, coughing, sneezing, and have fever. If they were all over the different places, that will be a different scenario. So that's why we say to people, if you have any symptoms of cough, fever, not feeling good, if you think you may be, having COVID-19 symptoms, it could be flu, it could be common cold, or something. They all look like similar, essentially. And now when we don't have any travel history also, so that makes it a little complicated, the best thing you can do is stay home. Call your doctor and get the advice if you need to get tested or not tested, or if your doctor advised that no, this could be, you're okay, then you will recover in a few days. That's up to their discretion.
Were these two both living at home? They weren't in. She wasn't in a nursing home or anything when she died.
No, nursing home is very different territory.
They were living at home.
They are independently living people. Yes.
In what town?
That is, as respectfully, I would say that we do not disclose that, and it does not matter which town they live in. So whether they live in north or south or east or west, that has nothing to do with what we are trying to do in terms of social distancing, in terms of advocating for take care of yourself. Because people, travel all over the place. They stay in one side. They do shop at one side. They have family and friends in the other part of the town. So I don't think we should focus on that rather than focus on, are these people well, and what were their contacts, and how we can make sure that they're in quarantine.
Is he in his 70s also?
Somewhat, yes. About
Somewhat?
the same age, yes.
And so neither of them worked outside the home?
That is something I think you're trying to go into. If they were working, we will be doing the investigation. So these are people who have limited exposure to people. That is important to remember. And also, it highlights the facts that think of those people, if somebody who was working in a facility and would have exposed so many people. So that, again, the take-home message is social distancing, washing your hands. If you're sick, don't go to work. Please call your employer and explain the situation.
Is anyone else isolating themselves who was in contact with them that you're aware of?
What do you mean?
Or is anyone else being quarantined?
So there are a few people who will be in quarantine. I don't think we are going to disclose
who were
who.
in contact with these?
Yeah,
Yeah.
so we give that advice. Yes.
Yeah, I think there's two things, right? So there's the health department does an investigation, and there are people that they deem necessary to be in quarantine. And then there are individuals who know these individuals who the health department does an investigation and deems you don't need to be in quarantine, but you can self-quarantine. So there's two types. There's the types that we're saying you're in quarantine. Then there's you had some contact with them. We don't believe they were symptomatic at that point. You don't need to be, but they do that anyway. So in this case, certainly, I think you have people that are in quarantine because of advice of the health department, and then people who are just self-quarantining. Also, I want to bring up Sarah Merrick. We've talked about continuity of services to review some of the continuity of services in this building. Sarah?
Yes. Good afternoon. Sarah Merrick, Commissioner of Department of Social Services. Just want to get the word out that programs, temporary assistance, SNAP, HEAP, child support, daycare subsidies, and Medicaid. They're all federal and state mandated programs. So we are still open for business. However, in normal circumstances, we see hundreds and hundreds of people on a daily basis come downtown to our department. We're really encouraging, before you make a trip downtown, to call this number, 315-435-2700. And we will be able to field most of your questions, deal with your benefit concerns via phone. We will require, if you have an emergency, like you need cash assistance, you have a housing crisis, that is when it would be important for you to visit our second floor. But we really really are encouraging. Before you travel to the Civic Center, please call us first. And we're still open for business, but we're going to try to do most of our work via the phone. Thank you.
Okay. Other questions?
Ryan, the Erie County Health Department put out guidance to its community about a positive case of COVID-19 and a list of places to the public that
Yeah.
if you were in that area, you need to contact them.
Mm-hmm.
Or you need to monitor for symptoms rather. One of those places is an Amtrak train from New York City to Buffalo.
Yep.
That same train stops in Utica and specifically Syracuse.
Sure.
Have you been made aware of that by the Erie County Health Department, and what should people in Syracuse know about that train?
Yeah, so that type of, if we get a case like that, we'll be probably making similar pleas, right? So far, the investigation with our positive cases are pretty contained. But certainly, look at Monroe County. Last week had a case, somebody was riding a bus, most likely came through Onondaga County, right? So similar to that, it's tough to tell in a community like this. It's easy. I think Oneida County's their case today is somebody who came back from international travel, positive, got off a plane, kind of self-quarantine. That's an easy story to tell. There's going to be complicated stories to tell, and there's going to be a puzzle for our investigators to put together. I think right now with our positive case that we have in our community right now is the health department's doing an investigation. We're respecting the privacy of these individuals. These are our neighbors. They did nothing wrong. And we're getting more and more comfortable with the facts related to this one case. And certainly where there's going to be different examples in this process where there will be the health department will be asking the community for help when they need help.
And I'm not trying to compare what another health department is doing. I'm saying if this train went through Syracuse and people may have been on the same train with a person found positive for COVID-19 who got off
Yeah,
the Buffalo.
so I think, if I'm wrong, doctor, you can let me know, but I believe we get that information, we investigate that as well.
So that kind of information from the different counties, we work through a regional office. So New York State Department of Health actually becomes the connecting dot, and they provide that information. It will be the same thing if our county resident have traveled through that. We do have very good connectivity between the counties in terms of relationship with the commissioners and all. So I have not heard anything at this point that any individual was actually disembarked here, and we look for that information from the New York State Department of Health if they have that. So it's all about what information is provided. If we do get that, then we would go and then do the same investigation.
Should people who have been on an Amtrak train recently check to see if they were on this exact train and start monitoring?
But that
themselves?
depends. It doesn't mean that person could be in a different, what do you call, car, right? Sorry. The car. So it depends where. If somebody is like 6 feet away, they have the mask and everything, how do you decide those? So a lot of details, without knowing those details, I am not going to comment on that because that will be inappropriate. What I can say at this point is what we look at the facts, we look at that it could be in a different car, doesn't mean it's going to transmit throughout the car. So if we didn't get a message, we are not going to start investigating. And sometimes people do contact us if they have questions, and we are there to help and support our community.
So perhaps the investigation in Erie County contacted who they felt appropriate.
Yes, they do.
Their investigation didn't reach to a distance where they wanted to contact.
So I'm right. So I'm not going to comment on how, but that's a standard process for any health department will be to do the whole investigation based on the index case and then try to walk that person's path where he or she was, and then look into getting the information for Amtrak, whether it's a plane, whether it's a personal car, or it's a restaurant, or different places. We just have to find those people. It's just walking back, right? That's what I had explained before, and trying to identify. It's a tedious work. You are dependent on people, how you are getting the information from different corporations, organizations, the bus industry, and then you kind of start to complete that investigation. Okay.
Brian, in regards to the homeless population, how are you helping shelters prepare should it spread within the shelters, and how would you plan to quarantine people who might be living
Yeah, so we have a human needs task force. We've been working with, again, our homeless population, our community is most vulnerable, right? So we've been working with the Rescue Mission, Salvation Army, and Catholic Charities. We have been giving protocol on how they are to deal with folks, and specifically folks with who are sick. We also have any homeless individual who normally stays at a shelter will be put in a quarantine at a hotel. So these are all things that we have been planned for and are ready for right now.
Is there any effort to put more people out into hotels preemptively, just to distance them?
No, Tim. We have contracted with hotels that we can use for various things in an emergency response. But right now, the shelters have beds. We have enough space. We've given them protocol, and they've been involved in all of our meetings related to food security, and certainly looking at proper protocols in the event that they believe there's someone who's symptomatic.
So you mentioned you have 250 slots in this building for child
Not in this
care.
building. Through Childcare Solutions, we have a network of daycare providers, and so that's why that number is important, because that may your kid, if you need daycare, your child may be going to. They'll try to geographically put you in the closest daycare, but you may be going outside of your town or outside of the city for that.
And have you guys been in contact with them as to how they're keeping those children safe that are coming in?
Yeah, look at there's guidance for all child care and daycare facilities right now from the state, and certainly many of these centers are practicing forms of social distancing as well. It is critical. These are just as important to this process and this pandemic. Child care workers are as important at this point as our doctors and our emergency management teams. So I want to thank them again and recognize that. But if you look at where we are, and that's why we're doing these briefings each day, and we put together a full picture for the community, and I want to thank you all for doing your part, and you're all doing a great job, is we started out with continuity of food for our most vulnerable, our children, and now our seniors. We now have a new demographic that needs our help that we know of today. That's independent seniors. We now have a continuity of food plan there. We then moved into the continuity of childcare to protect our infrastructure for emergency management and for our hospitals. We now have slots there. We realize we may need to complement that. From a testing standpoint, that was actually first. We have our triage testing site that we got up and running before our first case. So we've developed testing sites. Kraus has developed their own testing as well. Our primary care providers are now testing more. So we have a community response to the testing, to the continuity of food, to the continuity of care, and now we've implemented social distancing policies to try to starve the virus. And so we will continue now. We're at that end of the spectrum here, where we're going to continue to put in policies as we learn more about it that will starve this thing out.
Have you specifically heard from doctors or representation of the hospitals saying, I've got a handful of people that have kids that they're out of school, they can't come to work unless you step in and help, and I mean there's clearly a need. I'm just wondering if you've heard.
Yeah. Look at we talked to the medical community in advance of this weeks ago, Andrew, and their concern was when we get cases, just cases, we might lose half our workforce. So then what happens when you shut down schools, right? What happens to the rest? So we've been, every decision we've made, and at every point there's been high anxiety in the community, and nobody's felt it more than me, because I'm the one who, in many of these cases, have to make the final decision for the community. It's been to get to the point where we are, where these professionals can do their jobs, and I think we're there, and I think we're covering this, and we're continuing to build off as we see new gaps. But certainly there was widespread concern from hospitals and nursing homes going into this, that what happens in a community spread, and then if you lay the fact that kids are home, most of our healthcare workers are working parents, So these are challenges that we've been making decisions on trying to beef up and solidify our workforce.
The potential extra childcare that you might develop, is that just for healthcare first responders, or are you trying to accommodate other people?
Yeah,
too, or-
we're looking at where the gaps might be, Tim. Certainly, medical, healthcare, emergency first responders. Then I think next we got to look at strategic supply chains for the community to going through the pandemic. And then after that, certainly we can open it up to anybody. But that's part of this that we need to look at. You need to social distance. We need to social distance aggressively, but we still have to have parts of the community functioning, not just restaurants doing takeout for food, but people make that food, right? People distribute that food. If these things start to shut down, we got big problems. So that's what we're all doing, and we're all planning for is to figure out how we can starve out the virus and at the same time keep the necessary infrastructure in place for our community to function and function well.
Do you have any reports back today on how it's going with delivering meals and childcare and all the consequences of closing schools?
Yeah, I think we'll get some feedback, I'm sure, tomorrow, and I'm sure in my email box I'll get some feedback on how each one of the school districts did. School districts were very anxious to close. The superintendents and many teachers were very anxious. We'll see how well their plans worked and where we have to come in and complement and beef up their plans. We're not going to let kids go hungry, and so those plans were tested today, and certainly our teams will be reviewing with each district on how well that went.
How's the test site working, and do you expect our confirmed case number to go up in kind of a scary way once these results come back from testing all done on the same day?
Yeah, we'll get more cases, and we'll probably get them soon. So the test site has worked very well. The emergency rooms are handling emergencies, and the testing for COVID-19 is being handled where it should be. There's been a lot of activity, and so primary care providers are functioning very well right now. So we got there's lots of tests out there. We'll have more numbers as it goes through. Probably tomorrow we'll probably have an accurate idea how many tests are actually out there, and that information is probably going to be about 48 hours old. But certainly we anticipate the data is for every 100 tests you're going to get 2 or 3 positives, right? So I don't think we'll be any different.
So the cases that come back negative, is flu still on the rise? I mean, are there still any other illnesses?
Yeah, and that's why we did what we did earlier than when we had cases, is because if you just have the flu and you have respiratory challenges and you think you have COVID-19, even though you don't, they have to rule out COVID-19. So that's why we come up with a triage site as early as we did for testing. And that's why we started implementing the mass gathering bans before the state really acted. I don't know how long before, but we did it before. We're doing all this because we were concerned about that respiratory curve was like this one, it should be going like that. So if you got a cold now, we got to rule you out that you don't got COVID-19. So that strains the ERs, and that's why the testing sites are critical.
Is the community health center testing site, are they okay with the capacity of people they're seeing, or are they?
We're still open, Tim, but it's a lot of activity. So we're certainly our emergency supply chains have been strained, and we're pushing to get more.
Those first tests are probably due back like Thursday, Friday.
Yeah, I think they're talking. I think Derek was talking a 3-day turn time. So.
What's the capability of this room that we're in? I think you said on Facebook Live that it hasn't been used in 20 years.
Yeah.
What are some of the capabilities?
There's a lot of capabilities, and the other side of this is where the technology is. Now, this isn't our technology, everybody, but we make investments and make sure that we have the technology needed for this event. And our emergency management team, and they're doing a great job, prepares for events all year long. Now we know what the event looks like and how we can specifically adapt and put together the teams. But there's a lot that goes into this that you just don't think about for every different continuity of food site. You know, at certain sites you're going to need different security. You're going to have different various issues. So these are all things where our teams planned for it. Now we're executing it in this building appropriately. This center here needs to be functioning so that we can execute well.
What's some of the technology?
You're going to see it. You're going to see it.
So Budman made a contribution of equipment. Is there other specific stuff the county needs?
Yeah, look at from an emergency supply standpoint, the more we have, the better. But certainly,
Space suits or
yeah. If you make those, do you make those in your garage at home? Look at we really appreciate the outreach by many corporate partners offering to help. And I think the Village of Baldwinsville has a really cool page up right now where the community's helping each other. I think people should go to that, and that's what coming together looks like right there. And I want all our communities to do that and step up. We can't let fear drive decision making for this community, and that's what we're faced with now. This is a new phase in this, and people are going to probably know people that are in a quarantine because somebody was sick. And that's a new level of fear in the community. And we knew we would get here. The next few weeks, we got to get through it. And that's why we're extending ourselves the way we are as a government and as a community to help each other get through it. And we will get through it. Okay, so you guys ready for your little tour?
I'll take you guys.
Awesome. Yep.
I just want to publicly acknowledge the Commissioner's Green.